Vital signs are essential indicators of a person's overall health and well-being. They provide crucial information about the functioning of vital organs like the heart, lungs, and brain. Accurate measurement of vital signs is paramount in healthcare for several reasons. Firstly, it helps healthcare professionals assess the current health status of a patient. Secondly, it allows for the early detection of potential health issues. Thirdly, it aids in monitoring the effectiveness of treatments and interventions. Understanding how to measure vital signs accurately is crucial for any healthcare provider. This knowledge ensures that patients receive appropriate care and that potential health problems are identified promptly. In this essay, we will delve into the step-by-step process of measuring vital signs accurately, encompassing preparation, patient interaction, and specific techniques for each vital sign. Before measuring a patient's vital signs, it's important to gather all the necessary supplies. These include a stethoscope, a blood pressure cuff, a thermometer, a pulse oximeter, gloves, and disinfectant wipes. Always ensure that non-disposable items are properly cleaned and disinfected before and after each use. Hand hygiene is crucial. Wash your hands thoroughly with soap and water, or use an alcohol-based hand sanitizer before and after contact with each patient. Once your equipment is ready, it's time to interact with the patient. Begin by introducing yourself and clearly stating your role. Verify the patient's identity by confirming their name and date of birth. Explain the procedure to the patient in simple terms, ensuring they understand why you're taking their vital signs. Pain assessment is subjective but crucial. Ask the patient to rate their pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain imaginable. If the patient reports pain, inquire about its location, characteristics, and any factors that worsen or alleviate it. Document the pain assessment thoroughly. To measure oxygen saturation, use a pulse oximeter. Place the probe on the patient's finger, ensuring good circulation. The finger should be warm, pink, and free of nail polish. The pulse oximeter will display the SpO2 reading as a percentage. The normal SpO2 range is typically between 95% and 100%. Note that some medical conditions can affect SpO2 readings. Temperature can be measured using various methods, including oral, tympanic, temporal artery, axillary, and rectal. Each method has its own normal temperature range. For instance, the normal oral temperature range is 97 degrees Fahrenheit to 99 degrees Fahrenheit. Always use the appropriate thermometer and technique for the chosen method. To measure a patient's pulse, palpate the radial artery at the wrist. Use your index and middle fingers to feel for the pulsation. Count the number of beats for 30 seconds and multiply by 2 to obtain the heart rate in beats per minute. The normal resting heart rate for adults is typically between 60 beats per minute and 100 beats per minute. Respirations are assessed by observing the rise and fall of the patient's chest. While maintaining the pulse position, count the number of breaths the patient takes for 30 seconds and multiply by 2 to get the respiratory rate in breaths per minute. A normal respiratory rate for adults at rest is usually between 12 and 20 breaths per minute. Blood pressure measurement requires a stethoscope and a blood pressure cuff of the appropriate size. Wrap the cuff snugly around the patient's upper arm, positioning the lower edge of the cuff about 1 inch above the antecubital fossa. Place the stethoscope bell over the brachial artery. Inflate the cuff to about 30 millimeters of mercury above the estimated systolic pressure. Slowly release the pressure and listen for the Korotkov sounds. The first sound you hear is the systolic pressure, and the point at which the sounds disappear is the diastolic pressure.